you guys. In this lesson, we are going to be talking about the diagnosis meningitis. Now, obviously, meningitis can happen in adults too, so we really are just going to focus on how it affects kids. Okay, so let's just think about some basics. So meningitis is when the meninges become inflamed. Now, what are the meninges? Well, they are actually the membranes, and you can see here in the photo that actually cover and help protect the skull, the brain, and the spinal cord. And in meningitis, they become inflamed because of some kind of infection. So it could be bacterial, it could be viral, it could be a fungal infection, or a protozoan infection. If this is untreated, it causes swelling, increased intracranial pressure, and ultimately neurological damage. Meningitis is a medical emergency, is life-threatening, and also the longer we wait to treat, the more likely a child is to have long-term complications. And the long-term complications that we see most often are that a child develops a seizure disorder, that they have hearing loss, and that they also are at increased risk for having learning disabilities as they get older. Diagnosing meningitis requires doing a lumbar puncture so that the cerebral spinal fluid can be analyzed for signs of infection. And often this is going to be that maybe it's cloudy, there's increased white blood cells, and then they're going to send that CSF off to be actually cultured. Now you can see in the photo here the position that a baby needs to be in for a lumbar puncture. I've gotten more used to it over the years, but honestly, I still find doing LPs on little babies pretty awful. Now sometimes this is because symptoms are really non-specific. And so parents often feel really stressed out and really upset because their child is having to go through something as traumatic as a lumbar puncture. So often we have to be very careful to remind them of long-term complications of meningitis to help parents cope with seeing their baby go through all of this. Other things that we're going to do is they're going to need a blood culture and a urine culture, again, because the symptoms are nonspecific, and they're going to need to have an IV placed as well. So, like I said, lots of poking and prodding going on here. So while we're waiting on this blood culture and this urine culture and the lumbar culture to come back, so that's usually about 48 hours, these kids are going to be admitted to hospital and they're going to be getting antibiotics while we're waiting for those cultures to come back. Remember, it's life-threatening, so we've got to get those antibiotics on board, and they need those for those 48 hours, even though we don't necessarily know what's causing it. So really the classic triad of symptoms that you see for meningitis are fever, headache, and then meningeal signs. Now the classic meningeal signs that you might see are nuchal rigidity, which just means that there's a stiff neck, a positive Kernig sign, and then a positive Brudzinski sign. So a positive Kernig sign is when a patient has pain when their leg is extended while the hip is flexed at 90 degrees. Now that just sounds like a lot of words, but if you look up YouTube videos, they'll show you exactly how to do that and what I mean. And a positive Brudzinski sign is when a patient's neck is flexed forward, they experience a lot of pain. And it's so painful that they actually draw their knees up towards their chest to help relieve that pain. Vomiting is also pretty common for kids as well. But one thing I just want to point out really quickly is that these classical symptoms are pretty rare in infants and young kids. They just aren't going to be able to tell you that they have a headache or that they have photophobia. And it's really difficult and basically impossible to do Kernig's and Brudzinski's test on them. So things that you want to be looking out for in younger kids are high-pitched crying, poor feeding and lethargy, and then they may have bulging fontanelles as well. Remember, in emergency situations, you're always going to do a head-to-toe check looking for rashes. If you see a rash, you always want to press on it with your finger to see if it's a non-blanching rash. This just means that when you remove your finger, the skin beneath it isn't white from the pressure like it should be. It actually stays purple. So a non-blanching rash stays purple after you press on it. And the photo here is actually an extreme example of this kind of rash. This particular non-blanching rash is a sign of meningococcal disease. Meningococcal disease can present and look a lot like meningitis. It's super scary, and it progresses so quickly that within a matter of hours, a child can go from being almost perfectly well to dying. So if you see a rash like this and you see symptoms that look like meningitis, then you need to make sure these patients get antibiotics immediately. We don't wait for diagnostic tests to be done. If we have a rash like this, we're going to give those antibiotics straight away. Management of meningitis is all about giving the right medication to treat the cause. So usually we're going to be giving a broad spectrum antibiotic until we get those culture results back and we can know specifically what medications we need to give. If they have bacterial meningitis, they are probably going to be getting antibiotics for up to 10 to 14 days. Keep in mind that we have some special considerations here. If a baby is less than 8 weeks old, we have an even lower threshold for treating and suspecting meningitis. So we want to make sure that we're giving those antibiotics and antivirals because they are more likely to have problems if the meningitis goes untreated. As soon as you suspect that meningitis is a possible diagnosis, that child needs to be placed on droplet precautions. And then remember, long-term management is super important. Often a hearing test is going to be scheduled for about 6 months after the infection to just check for any kinds of hearing loss. And then one thing I just want to mention quickly is that from a nursing point of view, one of the greatest challenges with these patients is trying to keep a working IV in place. They're getting lots of medications. Sometimes they're really small and it's difficult to keep them. So some kids actually end up getting a PICC line. Your priority nursing concepts are intracranial regulation, infection control, and health promotion. Okay, so what do you absolutely have to know about meningitis? All right, first, meningitis is when the meninges or the membranes in the central nervous system become inflamed from an infection of some kind. The classic symptoms for this are fever, headache, and meningeal signs like a positive Kernig's, a stiff neck, and a positive Brudinski's. Remember, infants and young kids are very unlikely to have these classical symptoms, so be on the lookout for those things like high-pitched crying, bulging fontanelles, and poor feeding. Meningitis is diagnosed by doing a lumbar puncture where we're going to analyze and culture that cerebrospinal fluid. They're probably also going to need a blood culture and a urine culture. While we're waiting on the results of all these tests to come back, the patient needs to be admitted to hospital for 48 hours of antibiotics until we can get the specific antibiotic that we need to use. Management is all about treating the cause and monitoring that neurostatus and also the fluid status of the patient. Remember, long-term complications can also happen if we delay treatment. So things like learning disabilities, hearing loss, and seizures can happen. So we have to make sure we educate parents on this for future management. All right, that's it for our lesson on meningitis in pediatric patients. Make sure you check out all of the resources that we have attached to this lesson. Now go out and be your very best self today, and happy nursing!